being as one. So I'd like to welcome everyone to Finding the Fertility and Infertility with Helen, Adrienne, LCSW, BCD. And I look so forward to sharing more about Helen's background and introduce her to you in a few minutes from now. And I am Ed Glauser, the owner and principal clinician with the Mind Body Medicine Network and your host for our webinar this evening. So the next thing is I'd like to introduce Heather Butts. And Heather is with Learn for Life Consulting, LLC, and she is our producer for this evening's webinar, who will go over the technical aspects of our webinar experience this evening. So welcome, Heather.
Thank you so much, Ed. It's my pleasure to help you with any technical issues that may arise for you during our webinar. First, you can either listen to the webinar from your computer by clicking Listen in the information area of your control panel, or call the meeting burner phone number and enter the PIN number also listed in the information area of the control panel. It is highly recommended that you use the phone line in case we have any technical issues on the meeting burner platform. That phone number is on the control panel listed under Information. Also, you will now need to find the down arrows next to the host and information areas of your control panel and click on those down arrows to expand the chat area you'll be using for the rest of the webinar should you have any technical or content questions throughout the webinar and for questions and comments after Helen Adrienne concludes her presentation. And now I would like to turn it back over to Ed Glauser, the host of our webinar.
Well, thank you so much, Heather, for getting us rolling in terms of the technical aspects. And everyone is welcome, like Heather shared, to put anything you'd like in the chat area. We will not be using the Ask a Question icon, so please put any comments or questions throughout the webinar in the chat area. So now you see some information about the Mind Body Medicine Network, and you're welcome to check out our website for more information on all of our offerings, including our Blog Talk radio shows with Heather Butts, our webinars and webinar recordings, including our Mind Body Medicine sleep training that's coming up this spring of 2013. So now the Mind Body Medicine Network presents Finding the Fertility and Infertility with Helen Adrienne, LCSW, BCD, and I would love to read a little bit about Helen's background. Helen is an expert in the issue of infertility. She runs mind-body stress reduction groups for infertility at NYU Fertility Center, a graduate of Rutgers University and Fordham University Graduate School of Social Work, Social Service. Helen has taken advanced training in mind-body therapy at Harvard and clinical hypnotherapy at the Milton Erickson Training Institute in New York City. She is an approved consultant for the American Society of Clinical Hypnosis and is an associate trainer in Ericksonian hypnosis with Jeffrey Zeig, founder of the Milton H. Erickson Foundation. She also teaches the sensitivity management of infertility patients and mind-body interventions to other professionals at national and international conferences. Helen has authored many articles for the infertility patient, which can be found on her website, www.mind-body-unity.com, where you will also find her Baby Manifesto blog, and that blog's URL is www.mind-body-unity.com/blog.php/. She is also a blogger for Psychology Today, and her book on fertile ground, healing infertility, launched as a #1 bestseller on Amazon in January 2011. We are so fortunate to have Helen with us tonight. And Helen, it's all yours.
Oh, thank you so much, Ed. I take great pleasure in disseminating this kind of information. I really feel that working with fertility patients is a calling for me. And I just want to say that whether the audience is someone who is struggling with fertility, him or herself, whether the person that you love is struggling with it, a spouse, a daughter, a friend, or whether you're a professional person who works with infertility patients in the capacity of therapist or medical doctor, there'll be something in this webinar for you. So we can get started with the next slide, Ed. There are 7.3 million couples in the United States who are struggling to conceive. And reproduction is germane to our existence, and yet the numbers seem to be going up. I'm doing this work since 1979, at which point there were about 15% of couples of childbearing age who were in this challenge. And these days it's closer to 20%. And it really constitutes a bio, psycho, socio-spiritual crisis. And given that it could go on for a long time, it is really an ordeal, which is why I gave it the title that I gave it, Finding the Fertility in Infertility, because as this webinar goes along, I think you'll see the opportunities to step back and look at how you respond to stress. Stress has been measured to be on a par with terminal illnesses, HIV/AIDS, cancer, heart disease. And I just want to give you a little taste. The handouts that will be available to you have a long list of the biological, psychological, social, and spiritual components. But just to give you a kind of an overview, men and women typically feel defective. It is an ordeal to live in a body that is racked with stress, and then the medical setting intensifies the stress. And then just skipping to psychological, the one thing that everyone says is, I feel out of control. And life really becomes unrecognizable. Every 28 days feels like a death. When a woman gets her period, self-esteem flies out the window. There's a loss of privacy. And this is just a fraction of the list. And so sociologically, it can be summed up very simply. If you're struggling to have a baby, it seems as if babies are everywhere, except at the end of your stroller. And spiritually can be summed up pretty simply as well. It's the Jobian question, why me? This is something that fertility patients go to bed with at night and wake up with in the morning. Next slide.
Helen, before we go on to the next slide, I had a question. This may just be my perception or not. Why the folks who are dealing with infertility so underserved as compared to folks that are dealing with cancer, heart disease, and all the other illnesses and conditions that so many of us are more readily able to get information and help with?
And so your question is, why are they underserved, or are they underserved?
Does it seem that way as an expert who works in this?
Well, I think that those who get themselves to medical treatment, some of the clinics are, in fact, there are top-notch clinics all over the country, but a lot of women who live in the middle of the country don't necessarily live near a clinic. These treatments are expensive, and so that may preclude the ability to go the distance. So I think the treatment that's available is extraordinary. It's about whether or not people can get those services. That's really the issue.
And would that be including psychological and emotional support, or?
Well, that's a really great question. Now, the stress reduction classes that I teach at NYU are part of the wellness program because the powers that be at NYU recognized the need for services to go beyond just the body, which in fact is what my next slide is about. If you can just put it on, we can have this conversation and see. The treatment is about body parts, and the heart is the heart of the matter. And the wellness program that I'm a part of, along with acupuncture and yoga and nutrition, goes a distance to filling in that gap. But understandably, doctors are trained to deal with what is happening within the body, and the heart is both an organ and a metaphor. And the experience of infertility is a total mind, body, spirit experience. And if the mind and the spirit aren't addressed, then a woman and a couple are going to feel there's something missing. We can go to the next slide. Now, this is exactly what gets left out of the story in the fertility quest, that when a conception is not happening, lovemaking as a method of conceiving gets called into question. And if a couple is trying on their own, then there is an attempt to time intercourse with ovulation. And as you might imagine, the problem starts right there, because if this goes on for long enough, you hear men saying things like, "She only wants me when she's fertile," and the whole devastation, the self-esteem, and the chore of something that is a beautiful way to communicate gets lost in the shuffle. In the meantime, if a couple is in treatment, whether it's with intrauterine insemination, where the man's sperm is sometimes washed or tended to so that the best sperm are placed in the woman's vagina, or whether it's in vitro fertilization, where the woman's menstrual cycle is basically taken over so that her body can be encouraged to create extra ovum. The ovum are retrieved. They're fertilized in a petri dish. If fertilization takes place, then the embryos are graded. The top ones are put back in. The rest are frozen. I mean, we're talking science fiction here. And in that case, IUI, IVF, sex is unnecessary. Lovemaking is unnecessary. And what takes its place, we can see with the next slide. Imagine, instead of the privacy of your bedroom, to be in a situation where you're under fluorescent lights. And I just want to read a short rendition of the kinds of things that are available that make this process, this in vitro fertilization process, science fiction. And not only science fiction, but with so many decisions along the way that there needs to be very clear communication from the medical team to the patients and the partners to each other. There's something called intracytoplasmic sperm injection, in which case one sperm is literally injected into one ovum, and fertilization can be controlled in this way, and I can assure you that there are lots of little kids running around who are conceived by this method. There is sperm and ovum donation and ovum and embryo freezing. embryos that are left over when a couple gets their 2 or however many children they want. Those ovum need to be decided, are they going to be donated to another couple, donated to science? If a woman finds herself pregnant with triplets, there is something called selective reduction if she doesn't think she can handle it. So not right away now you're talking about the spiritual and moral component of this. There's PGD, in which case one cell is removed from a growing embryo and analyzed. Comparative genomic hybridization, where they're able to test all of the chromosomes and determine if there's normal, if they're all normal. If they're not, those are eliminated, which of course would eliminate a woman who is having miscarriages because there's a chromosomal problem. Sperm DNA integrity assay, because sometimes sperm look normal, but they may not be. So, I mean, I'm sure you can get a feel now for just how mind-boggling these choices are and these approaches are to the slide before, which is a couple going into the privacy of their bedroom, making love and coming out pregnant. Next slide, please. Now, part of what goes on with in vitro fertilization, and sometimes with intrauterine insemination as well, if it's a medicated cycle, the idea is to get a woman's ovary to be producing more than one ovum. And that's done by way of injections of various drugs. And so I've had women who have had needle phobia, and fortunately I have my training in clinical hypnosis, which helps enormously. I've had other women who are not too thrilled with the needle part of the story, and they're just so anxious to do anything that will get them pregnant that they get used to it and grin and bear it, basically. Sometimes the woman's cycle is flattened out altogether. She's put in a kind of a menopausal state. Why? So that the doctors can take over and control the ovulation. One of my patients really put it so bluntly and profoundly. She said, "It feels as if my body has been hijacked." Not to mention that these drugs that are injected make women feel, not all, but many women feel as if they're dealing with PMS, premenstrual syndrome, on steroids. And then there may be an issue of coordinating a cycle if a woman is not producing young, vibrant ovum. There's something called ovum donation, where they borrow ovum from a woman who agrees to donate, though their cycles then need to be coordinated. So there's an awful lot of manipulation that goes into this process. Next slide, please. Now, the ovum retrieval is surgery. In 1979, when I first started working with fertility patients, if tubes were blocked, they could do microsurgery. That is no longer necessary because the tubes can be bypassed. The ovum are retrieved in a surgical procedure. The husband or partner produces a sperm sample, and fertilization takes place in a petri dish. Next slide, please. Now, I mentioned intracytoplasmic sperm injection, and what you have here is a actual 4-panel view of what it is, what it looks like when the egg is held in place. The sperm is between what looks like little tweezers. The surface of the egg is penetrated. The sperm is released. And this is all under a microscope. Next slide, please. And this is the goal. This is a fertilized egg. And, in the course of working with women in my stress reduction groups, one of the components of the group is to highlight the value and the importance of maintaining joy in your life, but also maintaining humor. Even though there's nothing particularly funny about infertility, I encourage that somebody referred to laughter as internal jogging and how important it is to be able to maintain a sense of humor. So much so that one of my patients came in around a time when she had 14 of her ovum that fertilized, and it was the Christmas season, and she said that they were planning on hanging 14 stockings on the mantle. And what a kick they got out of that. Next slide. This is what happens during embryo transfer. That is, the embryos that are grown for 3 or 5 days in a petri dish across town are put into the syringe and inserted directly into the uterus. This is just the mechanics of it, but just to give you an idea of the emotional component and why I so readily went into this line of work, there can be an incredible insensitivity, even with well-meaning people. I had somebody come in and tell me that during her transfer she was horrified that the table faced an open door. Her head was at the far end, and there she was in all her glory with people marching back and forth while, as she put it, everyone was up in my business. And she said, couldn't they just turn the darn table the other way? It really is every step of the way. There's something else that contributes to the beating that self-esteem takes in this situation. Now, what I do want to talk about just for a moment is in your package you'll find an article that was written up in Fertility and Sterility, which is the gold standard of the reproductive endocrinologist world, is the major journal. And in it, there was an article that compared 2 matched groups who were going through IVF. The control group just had their treatment. The experimental group had only one little thing that was different that turned out to be quite a big thing. At the time of embryo transfer, they were administered a hypnotic intervention. And I don't know in the audience who knows about the power of hypnosis, having nothing to do with stage hypnosis, but it is something that allows a person to tune in from the inside and to bring themselves to a place of deep relaxation. And then the hypnotherapist is trained to speak to the unconscious mind with metaphors and stories and things that pertain to whatever it is that this patient is going through. Needless to say, the net result was that the experimental group had pregnancy rates that were twice that of the control group. So you're getting the overview now of what it entails to be an infertility patient. But what we're going to get to eventually touches on the power of some of these mind-body interventions to really make a big difference in outcome. Next slide, please. This is the readily available pregnancy test. It can be easily purchased in a drugstore. And women who are going through this rely on this because the 2-week wait from the time of embryo transfer until the blood test that confirms whether or not there's been a pregnancy is harrowing. And so very often they're looking to see if they can get a little hint with what's available on the market. Next slide. There's also an ovulation kit. In 1979, women were relegated to a basal body thermometer to determine whether or not they were ovulating, and there was some guesswork involved, whereas the ovulation kit does take that process and smooths it out. But this is just my way of saying that fertility patients live in their underwear. They're always looking, am I bleeding, am I not bleeding, should I be bleeding, should I not be bleeding. They are attached to the calendar, and it's just another example of what goes into being an infertility patient and how much of an emotional demand it is. Next slide. Now, obviously these are broken eggs, and that is the feeling that women report more often than not, that they feel defective. It is said that 35% of why a couple doesn't conceive has to do with the woman. Next slide. And you can imagine, I hope you're beginning to imagine, the emotional drain and the feelings of anxiety and depression, which, by the way, are universal in this population. And furthermore, these are not women who are in any way dysfunctional prior to this process. It is the process itself that, yes, it may heighten low-grade depression or some anxiety, but these are not women that would be seeking treatment necessarily for those things until infertility kicks it into high gear. The reason I put this slide in is because at one point I did a presentation to the in vitro fertilization nurses at NYU, and just really wanted them to know about all of the potential tools for helping patients relax. And one of them came over to me afterwards and she said, by the time these women are finished with the 4-hour orientation prior to starting in vitro fertilization, their hair hurts. So I thought this just about said it. Next slide. Now this is a testicular varicocele. It's one of the things that can be surgically repaired in a man, and the reasons that a couple is not conceiving, they estimate to be 35% due to male factor. Next slide. And the anguish for a man is as powerful as it is for a woman, except that men and women are oriented differently in our society. Men often try to hide that. They're more into fixing as opposed to feeling the emotions of. But the point is that providing a sperm sample is no picnic for men. Varicocelectomy is surgery for men. Miscarriage is a loss of a child for him as well as for her. And, you know, some of the humiliation that went along with the woman whose table faced the door is true for men as well. Next slide. 20% of why a couple is not conceiving has to do with the man and the woman. And the next slide. I've been told that 10%, the remaining 10%, is unexplained. I don't know whether my population is skewed or not, but it seems to me that there are more than 10% of the people that I see who have what's called unexplained infertility, which is really so hard to wrap your brain around, because as they've said to me so often, at least if I had a diagnosis, there would be something that they could do about it. This is one place that I just want to put out something to chew on that we're not going to have time to really get into at great detail. But basically, some of the unexplained may very well have to do with age. As a woman gets near 40 and into her early 40s, fertility has declined by quite a bit. But then there is the possibility that there is something stuck emotionally that is preventing pregnancy. Now, the one thing I want to make very clear, and I cannot emphasize this enough, if there is something that is stuck emotionally, it is most likely to be unconscious, right? And because it's unconscious, the last thing that I would want any fertility patient to be walking around with is, this is my fault. Fault is out of the story. But if there is an issue of having had an abortion, I can tell you right now that can be worked through. If there is an issue of the kind of mothering that you had that makes you worry about the kind of mother that you will be, this also can be worked through. So since this is not a forum for discussing what can be very individualized emotional issues, I just leave it there so that anybody who's listening to this can chew on it and assess whether or not there's any relevancy, because help is out there. Next slide.
And I just want to thank you, Helen, for talking about that, because you know, we've moved from a biological possible explanation for infertility, and you're really expanding the conversation to talk about some emotional issues, many of which are on an unconscious level. So that's just so helpful, and thank you for bringing that up.
Yeah. I mean, I had somebody come in many years ago and say, is this my fault? And I said to her straight away, you know, I don't like that word, but let's talk about why it comes to mind for you. So that's important. This slide is really my way of calling your attention to the potential impact on a couple. I would say that, yes, there are some couples who are wobbly in their connectedness to begin with. And Chapter 3 of my book, I described a couple like that I worked with. They were so relieved that their son wasn't born until they had worked with me and really came to a place where they understood why they were unable to love each other in a good way. But most couples pull together. It does throw issues into high relief. Everybody's self-esteem is down. The man wants to protect the wife, so he doesn't say how he's feeling. He's inclined to want to fix what's wrong, and this is a process that when you think about in vitro fertilization and the wait and everything else that goes on, and then if it fails, having to wait months again, this can be such a long, drawn-out process that nerves can be very raw. And then on top of that, there is the issue of desire and what happens to sex as a beautiful way of communicating. There is a potential to destabilize, sometimes in spite of the determination to get through this. And couples get through it, but it can present a really rocky road. At the same time, going back to my title, Finding the Fertility in Infertility, it's an opportunity to scrutinize the couple's definition of intimacy. It's an opportunity to learn how to communicate clearly. It's an opportunity to learn how to advocate for what you need as you go through all of this. Basically, a huge opportunity for growth in the relationship. And I'll have more to say about that as we go on. Next slide, please.
Hi, Helen. This is Heather Butts. I had a quick question for you, actually.
Sure.
And the question has to do with what you were just speaking about regarding women getting older and fertility issues and that 10% unexplained. And I wonder if you could maybe talk a little bit about the media's influence on some of that, because, I mean, I know for myself as, you know, someone who watches television and films and so forth, it just seems like you get bombarded a little bit with these images of women, you know, well into their 40s and beyond, seemingly, you know, with quite a lot of ease having children. And I think it sort of creates a perception that you can easily have children, you know, for many, many years. So maybe you could talk to that a little bit.
I think that's an important question, because what you don't know about the Hollywood people who are popping out babies is they have unlimited funds, presumably, where they can get the treatment that they need. But the other thing is, how is our society organized in terms of expectations of women who are now doctors and lawyers, and they're in finance, and they travel for their business, and they're really under the gun to be in a man's world at the same time that they're in a woman's body. And I have an association with several acupuncturists. I'm thinking about one in particular right now who is Eurasian, and her mother was Vietnamese, her dad was an American, and so she goes to Vietnam, and she described to me how she looks around, and there are families and with many children, and they range in age from in the teens to you know, to toddlers and newborns, and so these women are approaching or beyond age 40, and she really feels that there's a nutritional component, there is a self-care component, which is where I come in, that can make a difference. We also don't know what lifestyle issues, what chemicals, you know, environmentally may be playing a part here. But you can't judge a magazine by its cover, if you know what I mean.
I like that.
This slide is really where my work with infertility patients comes in, aside from giving them a sense of normalcy, because I understand all of the issues that I just described in the first half of this webinar. But it is about healing heartache, and it is about having a crisis that can be looked upon as an opportunity, as a way of taking that feeling of I am out of control and morphing it into I can be empowered. And there are several ways that I work to empower people. Well, I should say encourage them to take their power back. I don't really do anything. I just, I know what I know, and then it's up to the woman to grab it. And I see them grabbing it like they're 10 years old and it's an ice cream sundae. Basically, I teach mind-body interventions. I give out self-assessment rating scales, which would be in the package that the listeners here can download, including stress warning signals, lifestyle issues, self-esteem, and underlying beliefs inventory. I encourage people to look in the mirror, to look at how they react to stress. Because the idea is that if you can be studying yourself, you can step back and learn how to respond to stress. And I do this around 6 primary traits. Anger, which goes off the charts with this, what do you mean, everybody's getting pregnant and then there's me, and everything that's attached to that. And by the way, I did a pilot study, and long story short, it was noted that when people use the mind-body interventions, that levels of anger go down in a statistically significant way. And just think about what it's like to live in an angry body when you're trying to conceive. Another issue that I invite people to look at is, where do they stand on negativity? This is probably my most popular class, Transforming Negativity, and it can be transformed. First, you have to identify that you have it. Insecurity, impatience, self-esteem, and fear. And then the other framework that I use with people is what I call the 3 A's, that in order to move forward with anything that you're struggling with, you have to accept that this is where you're at. You have to build awareness, which the self-rating scales and looking in the mirror, and where that informs your opportunity to then go on to the 3rd A, which is to adapt to what's going on. And that's where the mind-body interventions come in. Now, it's interesting because people who take my class, and I bombard them with every coping mechanism known to man so that they have a choice of how they can learn to respond rather than react to stress. But studying yourself when you're in no mood, you have a job. You have the job of your your relationship and keeping a home, and you have the job of infertility treatment. And now I'm saying, well, here's another job. You can study yourself. It takes a while for the profundity of that to sink in, but once it does, then everything can change. Because the women who were brought to that place of serenity during embryo transfer with the hypnosis and the other interventions that are in the meditative category do go a long way to changing the stress response when you're struggling with infertility. Next slide.
Before we move on to the next slide, Helen, this is Ed Glauser, the host. How often do you work with men in terms of percentage, and how receptive are men to your work?
Well, I love working with couples, and I certainly have worked with men individually. But it's been a bit of a surprise to me that when I get a phone call from someone who wants to make an appointment, I will say, would you like to bring your partner in? And so often they say no, because they just need to have a place to go where they feel that they're not stressing out the partner. They can say anything to me, and I'll be there for them. And so I don't work with men as often as I work with women, but I certainly welcome the opportunity, and I find it to be a very important advantage when I can work with both of the men and the women. Does that answer your question, Ed?
Oh, very much. Thank you.
Okay, good. Now this three-legged stool is right out of Dr. Herbert Benson's teaching at Harvard when I took the mind-body training. This is what he says overall health looks like. Doctors can provide pharmaceuticals, and they can provide surgery. They cannot provide the third leg of the stool, which is self-care. And self-care is the place where what I do with patients comes in. And, I've had women who have recognized that they're overworked. They'll take a leave when they're doing an IVF cycle. I've had women switch jobs. I've had women pull themselves off a partner track in a law firm. And then, of course, there are so many components to that. There's, as I said before, the nutritional piece. There are women who have an intuitive sense that the ancient approaches, such as acupuncture, can make a difference. And then the mind-body interventions, both the cognitive and the meditative, are where I come in to the story. But this is a very important conceptual way of understanding what's going on. Next slide. Okay, so there's doing coping and there's being coping. And this is just something that I saw on a T-shirt once that struck me as a way of adding a little levity to this. Someone has said we're not human doings, we're human beings, but a lot of times we forget about the being part. And that a lot of times when people are anxious, they look for what they can do, like vacuum anything that doesn't answer them back, or shop, or all kinds of tricks of the trade to deal with anxiety. There was another study that's also in the packet that talks about the difference between problem-solving coping, which is the doing part, and letting go coping, which is the being part. And if you would go to the next slide, you can see here that the problem-solving techniques fit in very nicely if there's a problem to which there is a solution. I don't like my doctor, I can go to a different doctor, that kind of thing. The problem with infertility is that it goes on for such a long time, and not every problem has a solution, because the solution as far as infertility patients are concerned is I want to be pregnant yesterday. So they need to tame themselves down. That's where the impatience part comes in. But these are just a couple of the things, and this is going to be in the packet as well, the various coping by doing approaches. In the next slide, you can see that there are things that have to do with just letting yourself be. People go on the internet and they buy guided imagery tapes. Sometimes they study mindfulness. If any of the listeners lives near a labyrinth, to walk a labyrinth, it can have such a calming effect on a autonomic nervous system that is buzzing day and night. Certainly hypnosis. I've had people swear that it's the hypnosis that got them pregnant, but my feeling is that I'm happy to work with people in that way. They feel as if they're participating. But modern medicine is quite wondrous. And then at the end of this presentation, I'm going to teach the relaxation response. And basically, I look at these things as going under the turbulence. I remember when I was around 12 years old and living on the East Coast, I loved getting to the beach and learning how to deal with the waves and the breakers and the rollers and high tide, low tide. And at one point, part of being 12 was, well, I can be under the ocean, I can have my eyes open. And I had a wave coming toward me, and I dove under the wave, under the turbulence, as I like to say, with my eyes open, and I couldn't help but notice how still the ocean floor was, even as I felt the roller going over my back, the turbulence going over my back. And this is a kind of a metaphor for the way that letting go techniques can make all the difference, that there's no surefire solution. So if you do the relaxation response, you will be calm until you get pregnant or until you resolve this fertility crisis by hook or by crook. No. Anxiety comes and goes. Disappointments come and go. Anticipation comes and goes. And you have to be able to recognize, if you're studying yourself, that, oops, I need something to bring myself to a place of inner peace, inner calm, serenity, tranquility, whatever you want to call it. And you have to then grab at whatever technique you've learned that works for you to bring yourself under that rushing wave coming at you. And with the fertility struggle, that can be as good as it gets. I have another two metaphors that I use. If you would give me the next slide. This is a hurricane. And the center, which looks a bit clear, looks that way because it is clear. Now this is like 200 miles across. But the center of that hurricane is called the eye of the storm. And it is the place through which the sun shines. And infertility is like a hurricane. The frenzy of it is like a hurricane. And I always tell people that it is up to you to find a place where the sun shines so that you don't lose 6 months, a year, 5 years of your life just being miserable with your goal being thwarted. That you want to be able to say, boy, those were difficult years, but they were also the years where, and then fill in the blank. We learned how to love each other better. I learned to deal with stress differently. You name the opportunity to become an improved version of yourself, and it takes place in the eye of the storm. The next slide is another metaphor. And we don't do much with campfires, certainly not in cities, maybe summer vacations or children who go to camp. But I recently visited an indigenous community in South Africa, and it was a joyous experience to have the children teach us songs, and we taught them American songs. And then as we were leaving, the gentleman who toured us around said, "You are going to be the talk of the campfire tonight, because drumming, singing, dancing, storytelling around a hypnotic fire goes a long way to reducing the physiology of stress." And indigenous cultures still know this. And in our multitasking world, we tend to forget it. And in fact, if you give me the next slide, Ed, this is what we're often faced with. That even with the opportunity to relax, if you're what has been referred to as type A, it feels foreign to get into a place where you're getting involved in letting go, coping, just rocking back and forth in a hammock and watching the cloud formations or watching the light, the dappled light coming through the leaves. Do you know what relaxation means? And I have found that I have to coach people that sometimes anxiety kicks in because they've learned how to relax. And it just feels so foreign that the body is going back and forth and going haywire, which you'll see again in the next slide in a different way. People who have a list, well, if I do yoga, if I go to acupuncture, if I eat differently, if I don't drink, if I don't have caffeine. But you know what? If it's just checking off the list, then it's not really getting into Dr. Benson's third leg of the stool, that self-care, leg of the stool. And I just want people to know that it's very normal to resist change, because we become accustomed to ourselves in a certain way, and then it becomes disorienting if we start behaving in a different way. But I can assure you that if change were not possible, if adapting to being a different version of yourself were not possible, me and my colleagues would not have a job. So, I've been doing this work for a long time, and I so believe in it. Okay. This next slide is just a way of my laying out a kind of map for people to understand that letting go coping can be a lot of things. It can be getting into a relaxed place. It can be following imagery. When I work with people who are wanting to learn how to let go and let down, I'll always ask them, where out in nature do you feel most relaxed? And then if it's the beach, I will work with them with imagery of the beach. And because we're wired the way we're wired, we don't know when we're using the power of our creative imagination that we're not at the beach. So that's one way of helping people shift from one state of frenzied activity and disruption to another state of letting go, letting down. But another way that I work with people is to literally use the mind to enter the body. And so when I work with someone who is being injected with the superovulating drugs, for instance, I can work with that person hypnotically so that she can actually join the medication and potentiate its impact on her body. She can be receptive to what the medicine is designed to do. And again, these are people who feel out of control. So the idea that they can be participating and not just on the other end of a table with their legs in stirrups is very, very important and relieving. And the next couple of slides, I think, are they are from the movie which came out in 1967 called Fantastic Voyage. And this is the way that I introduce this to professionals, and sometimes these are movie clips that I will even play for patients before I work with them hypnotically. This first slide is having been shrunk inside a submarine and injected into a bloodstream. You can see these two of the scientists who are now observing the red blood cells and the blood serum, and they're marveling at what it's like to be inside the body. And this touches off that creative zone in the people that I'm working with, and it gives professionals an idea of how to work literally with fertility patients. I think the next slide is another rendition of this that so you could skip over to the two. Okay, Ocean of Life. Go beyond that now, Ed. Okay, now this is a part in the film where they are communicating with the scientists who are outside of this person's body. And because they've made a wrong turn, it's a way of building suspense in a movie, they have to shut the heart down in order to go through and get to the other side. And it was the part of this movie that stayed with me all of these years and made me realize what a valuable tool I would have in working with professionals and with patients, because you see as they're getting closer to the heart before they shut the heart down, and they're wobbling back and forth, and they're saying, my goodness, it sounds like heavy artillery. And just, then you can do all kinds of things with the heart as a literal organ, the heart as a metaphor. In fact, the language of acupuncture calls the uterus the little heart, which I think says an awful lot. Next slide, please. And here you can see the little white oval that's just off center. That's the submarine that these scientists are in. And what you can't tell terribly well are these white flashes that are going off. Now they're in the man's brain. And the white flashes are meant to be electrical impulses. And what I tell people is that every thought is an electrical impulse that converts into a messenger molecule and travels somewhere in the body to a receptor site, so that I'll never get pregnant, which is the underlying belief part of the handout that I have in that package. I'll never get pregnant is going to travel to a very different place than, wow, what a wonderful opportunity I have to conceive this month with these treatments. So that's where the brain comes into the story. And you can work with musculature, relaxing musculature. The potential is pretty infinite. Next slide. Okay, so now this is nothing in particular except the logo for my website. But it's meant to portray the frame of mind that I'd like to guide you into in these next moments. I did promise that I would teach the relaxation response. So Ed, unless there are any questions, or Heather, I would go ahead with this. But it's a great way to end this webinar and kind of float back on a Sunday evening and have a relaxing rest of the evening. So questions now would be great.
So Helen, would you prefer questions now or after the meditation?
Well, now would be great, but the relaxation response may engender questions of its own. So I really feel that either is okay. But anybody that wants to ask a question now, let's take a moment.
Heather, our producer, do we have any questions now, or we can also entertain those questions after the meditation?
Sure, we have a couple of questions. If you'd like for me to hold them, I certainly can. And there might be a couple more afterwards, so you let me know. Would you like to take them now?
I think that since questions are a left brain activity and doing the relaxation response is a right brain activity, I'd like to take whatever one or two questions you have now, and then if there are any after the relaxation response, then I'm happy to do that as well.
Wonderful. Okay, so one question has to do with the level of pressure that comes through the infertility process that happens with a couple. And I think, some of this is prompted by Ed's question about, do you treat men? But maybe you could speak a little bit to the pressures that couples are under when they go through this process and what this can do to a relationship over time.
A lot of the pressure is the shift in the social situation. These are people who are no longer in the mainstream. And the way I said it in my book was that the mainstream is going that way and you're in a tributary that feels like it's headed for Niagara Falls. Who needs to be invited into the sanctity of your marriage? You've got so much pressure between the couple. You certainly need medical intervention. And then if you have the habit of meeting friends after work, for happy hour, and suddenly you're drinking club soda, everybody's going to be looking at you. And what if you don't want to tell anyone? What if you don't want to tell even family? What if the people who sit in the next cubicle, or you, or your customers or clients, are all popping out babies left and right? What if the parties that you go to, everybody's saying, I know the best high chair, I know the best, pediatrician. And so everything that you want to be doing is in your face. And you're just sitting there. So if that doesn't constitute pressure, I'm not quite sure what would. Is there more, Heather? Heather?
I guess Heather has probably attended something else for the time being, so
Okay.
This might be a wonderful time to do our relaxation response, and then
Sure.
Afterwards we may have a few more questions.
Okay, so basically the relaxation response is something that I'm going to introduce after I ask the audience to do a couple of things. I'd like you first to do a little body scan from head to toe or from toe to head, and to evaluate whether there are any areas of your body that are really bringing your attention to that place. It could be you're aware of a kink in your neck, or your stomach is grumbling, anything at all that you're noticing that might fall in the category of discomfort. And just put it on a scale of 0 to 10, 10 being very intense, intensely stressed in one way or another, and 0 being that you're feeling perfectly at ease. And then allow yourself to take a generous, slow, little deeper than usual inhalation and a lovely exhalation like this. And then notice with another body scan where you would rate yourself. Now, I don't know, because I don't have direct contact with the people who are listening to this, what would be going on for you, but I can tell you that most people, the vast majority of people, find that even one breath can make a difference. So then we can hold in abeyance if one breath can make a difference. What if we breathed purposefully for an extended period of time? All right? Okay, now the next thing that I'd like to do is invite people to use either hand and to make a fist as tight as you can. Tighter, 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 tighter. Now notice what happens to your breathing. And since the audience is not able to respond, I can tell you what I get invariably, which is either my breathing has stopped or their breathing is shallow. And so the fist represents stress. When we are stressed, we don't breathe fully, right? So now we know that there's a need to breathe. We've demonstrated that. Our breath is a gift. It's a built-in tranquilizer. But how can you breathe for an extended period of time without getting lost? And that's where Dr. Benson's genius comes in, because he figured out a way to keep the mind from being what he called a monkey mind, jumping all over the place. And that is to select a word, a phrase, or a prayer, and to coordinate it with your breathing. So I'll demonstrate that for you. You can pick any kind of word at all, including waterfall or sunset or ocean or the word love, and say it to yourself every time you exhale. So what that would look like would be this. Ocean. Ocean. You don't say it out loud, you say it mentally, and I can guarantee you will lose your place. Let it go by saying, oh well, and start again. Right? If you would prefer to pick a phrase or a prayer, you say half to yourself on the inhalation, the other half to yourself on the exhalation, and that sounds like this. I am at peace. I am at peace. And again, be warned, you're likely to lose your place. This is a skill that needs to be practiced in order to develop in a way that serves you. So what I'm going to do now is I'm going to invite you to select a word, a phrase, or a piece of a prayer. If it's a word, say it to yourself when you exhale. If it's a phrase or a prayer, say half on the inhalation, the other half on the exhalation. And by the way, the reason that this is so powerful is because if you are invested in this process, you are also invested in the present moment. And one of the things that happens with stress is that we ruminate about the past or we drive ourselves crazy about the future. And all that any of us have really is the present moment. So just take the time to get comfortable so that you can be with me fully, taking yourself from wherever you've been to the wonderful potential of where you can go by breathing in the now, breathing in the present moment. And I invite you to begin this process with what I call a cleansing breath, just a way of separating before from now. That's right. And now just simply resting in the rhythm of your breathing. And let it be a way for you to become aware of your vitality, aware of your compassion for yourself if you're struggling with the fertility challenge, aware of your compassion for any patient or client that you might work with, and to really take on board that every time you bring awareness to the breath, and you can hold yourself to that awareness of the breath, it's a way of bringing the mind into the body. Say it another way, it's a way of being fully embodied. This is where mind, body, medicine really comes from. And we can't leave out spirit, and this is not about religion, but if you notice on an inhalation, there's a feeling of moving up. And you can take that however you want. And then I'd like you to notice that on an exhalation, there's a feeling of moving down, down into that place, deep within each of us, the center of our being, where our truth and wisdom wait for us. And quite frankly, I'm not sure that going up and out or down and in is terribly different. But to just continue utilizing your breath and bringing awareness to it. And thinking about the way that you can use the breath to take yourself under whatever turbulence might be in your life, because we're all infertile in some way. And now to select and recruit that word, phrase, or prayer, and practice coordinating the word with an exhale, the phrase or prayer divided in half on the inhalation and the exhalation as I remain quiet for just a brief while. Lovely smooth inhalations. Lovely releasing and relieving exhalations. Using your breath now to very gradually and respectfully transition yourself back to ordinary reality. Once again, noticing the way that focus on the breath can bring us so fully into our bodies, into our vitality, into our aliveness, and at the same time serve as a way to empower yourself to own serenity, tranquility, harmony. And then whenever it is that you feel ready, bringing yourself back fully, alert, and aware, and prepared to go on with the rest of your day, bringing whatever benefit you've derived from this last little while with you. Okay, welcome back. And you might want to use that rating scale again to compare where you were to where you are, and to really take on board that this is yours for the taking. And the instructions for doing the relaxation response are part of the package. And furthermore, I'd be more than happy to be available either by email or by phone for anyone who might have questions that they think of tomorrow or next week. And my email address is helen@mind-body-unity.com. And my phone number is 212-758-0125. And thank you for attending.
Well, Helen, thank you so much for a beautiful relaxation response exercise. Your entire webinar was thoughtful, comprehensive. It was encouraging, empowering, and I can't thank you enough. I am a fellow clinician, also trained by the American Society of Clinical Hypnosis. And even with that training, I really didn't know how to approach folks that are dealing with infertility issues and applying clinical hypnosis to that. So I want to thank you so much for that. And I also wanted to let everyone know that this would be the time as we wrap up in the next 5 to 10 minutes to type your questions and comments in the chat area. And I would like to ask our producer, Heather Butts, with Learn for Life Consulting, if we have any questions.
So, hi again, Helen. That was really wonderful. That exercise.
Thank you so much.
Oh my goodness, it was unbelievable. One quick question is: at what point do or should individuals come to you along the spectrum of their fertility issues? So when are the best times for people to come to you, or is there no best time?
Well, I think the word spectrum really highlights that people go through a process, and any time along the way, sometimes people recognize right away that this is bigger than a bread box. But again, the finances of fertility is just so extraordinary that very often they'll find my website and they'll see that I can work with them hypnotically. And the thing about that that's so fantastic is that I make an MP3 of the session So basically, it's very cost effective. They get to take the hypnosis home with them and practice with it, whether it's for an embryo transfer or whether it's for just getting themselves inside their skin or unraveling some of the issues, the personal issues that they may have had. But I think mostly it's such a, as I said, bio, psycho, socio-spiritual crisis that if people come in even before they're being treated medically, it's logical to need clarification because they feel so lost and so relieved to feel understood. And by the way, if I may take a moment to say that I had an email just last week from someone who said that she had gotten my book and just reading the book made her feel better. I've also had colleagues call and say, you know, Helen, I bought your book, and wouldn't you know it, this week 3 people came in with fertility problems, and thank God I had a handle on it from the information that's in your book. And not only that, but I teach mind-body interventions in the book as well at the end of every chapter. So if you liked what went on here, the listeners, then you can reinforce it with my handouts and with the book.
And then the second question has to do with something you alluded to earlier, which has to do with the pressure that oftentimes women have, not only in terms of becoming pregnant, but also just the pressures of everyday life and sort of being superwomen and so forth. And so maybe you could talk a little bit to women sort of coping with trying to do it all and how that might affect their ability to actually have children.
Well, as I said before, there are some women who will pull back from these incredibly hectic schedules, but I have to say that there are women who can't afford to take a lesser involved job or to cut back on their job, and that's where the practice of these exercises that take you to the campfire or the eye of the storm or under the turbulence, whatever you want to call it, are so important because there is something about the way we are wired that is a whole topic unto itself, the way our brains are organized. The part of the brain that we use when we're doing any of these letting go techniques cannot tell time. It's called the limbic system of the brain. Sometimes it's called the emotional brain. It connects the mind and the body. The structures of the limbic brain connect the mind and the body. It has no idea what time it is. And, you know, everyone has had some experience where they drive from, you know, New York to Philadelphia. It takes 2 hours. They get in the car and drive from Philadelphia back to New York, and they say, how did we get here so fast? It's called time distortion. And so if you practice the relaxation response 10 to 20 minutes, once a day, as much as you need, 3 times a day, even if you take a couple of deep breaths, the limbic brain doesn't know that it's 5 minutes or 20 minutes. And it's enough time to create a space between this mental, physical stress and aiming toward neutral, if you know what I mean by that. And so it's letting go. It's just letting the grip, the spasm, whether it's muscle tension or mental tension. You know, you're in a frenzy over, you know, the retrieval or the transfer or whatever. Just giving your mind a hiatus from that stress, giving your body by breathing richly for 10 to 20 minutes. The body interprets that as more than 5 minutes, 20 minutes, an hour, whatever it is that you devote to distancing yourself from the capacity that infertility has to put people in a real knot.
Thank you.
My pleasure.
Well, Helen, I want to thank you, Helen Adrienne, LCSW, BCD, our presenter this evening, for finding the fertility and infertility. I want to thank you so much for what a service you have rendered during this webinar, and I know many people will benefit not only from this evening's webinar, but this will be archived as a recording on the Mind Body Medicine Network website. Again, you can reach Helen Adrienne at helen@mind-body-unity.com, as well as her phone number, 212-758-0125. Those of you that have listened to this webinar live will be getting the packet that Helen referred to throughout the webinar tomorrow, along with your recording. So I want to thank everyone for joining us this evening. The Mind Body Medicine Network will have more webinars in 2013. This is our grand finale for 2012. And I would like to, pass it on to Helen if you had any final comments.
The only thing I'd like to say is that I have felt since 1979 that I am an advocate for infertility patients, that they are a niche. There may be 7.3 million of them, but they do feel out of the mainstream, and helping others to understand just what an actual scourge this is for those who are going through it is my mission, and then to give relief to people who are suffering in that way.
Well, Helen, thank you so much, and we have gained so much by your presentation, your webinar, and I want to thank you so much. And everyone, thank you for joining us, and we look forward to having you join us for future Mind Body Medicine Network webinars. So at this point, we will say good night and